Hello. I want to talk about a few drugs from now on. There may be just one drug per short video. The first drug I took on a regular basis, not every day, was a drug called NAPROSYN, NAPROSYN. It's a derivative of aspirin. It's quite powerful. I took it because I had arthritis, and it might have been gout, but it certainly was quite painful at times in the knees and in the fingers. And I was about 40, although the pains started probably in my mid-20s. Sometimes I got sore feet and heels from walking. My mother had severe arthritis. Now, it did give relief. However, the doctors that handed it out and the chemists, all they said was take it with food, and it said that on the label anyhow. And I tried to do that. But its dangers and possible bad side effects were never mentioned. I don't think I got any handouts or any briefings on this. Some doctors do brief patients, but these days, the doctors that I've encountered, no, they don't at all. And chemists rarely give any major briefing on tablets, the ones I've been to. If you ask them questions, they'll answer and give you more details and sometimes hand you a pamphlet. But it's just a sales procedure. One person has been very cruel to doctors and chemists, pharmacists, and said, well, if they don't give any kind of other help and don't give you background information, they're just drug dealers, licensed drug dealers. That's pretty tough. Anyhow, I do think all drugs need to give or to have a briefing from someone. The minimal briefing is a pamphlet, but it's necessary to talk to the patient as well to reinforce what's in the pamphlet. I guess the most important things we buy are health services and health products. Other things might cost more, but these are very, very important for individuals. Now, my view is we should only take tablets when we really need to, when they're really necessary. I just took tablets without question in many instances until the last few years. But now, with ChatGPT, you realise this was a unwise approach, although it was hard to get information on tablets and there was more trust between doctors and patients. So, this drug naproxen is used for other things as well. It can cause stomach bleeding, it can cause blood pressure to rise, and numerous other problems in people, and this was not explained. It shouldn't be taken regularly in the sense of every day for a month or a year. One doctor gave me naproxen to take for a year. I think it was 1,000 milligrams. This was irresponsible. I did it, and then I came off it because I said, I'm still taking these drugs. You want me to still take the drugs? Oh, no. So that was a classic case where doctors didn't follow up. Now, car servicing places often follow up and ask you how the car's going after the service and have you got any more needs for the car that you didn't get attended to. eBay, when you buy a product from them, they often send you a note begging you to give some feedback. Now, the same thing with Amazon. They want to know whether the product was satisfactory, whether it arrived on time. But chemists and doctors these days rarely follow up. You go back if you're sick and you think it might be the tablet. So doctors and chemists almost wash their hands of anything that's going to happen after the tablet's issued. Now, tablets are not tailored to individuals. There's kind of protocols, what tablets are appropriate for certain illnesses, but of course we all vary, particularly in age. And I've found that as I've got older, I'm more prone to the side effects of tablets. But yes, we've got a problem with follow-up. There's two aspects to the follow-up. Did it alleviate or cure the problem? Did you have any side effects? Are they serious? And be sure to not take the tablet for more than a given period. There's no exact period for NAPROSYN, but at my age, I've been told not to take it for more than a few days. In fact, a one-off is okay. Anything more than that has a bit of a question mark. That's for my condition. Who says that? ChatGPT, which knows my medical history pretty well, but not perfectly. So I'll just leave it at that.